Welcome to Inside ProMedica, your path to wellness. Brought to you by ProMedica Charles and Virginia Hickman Hospital, where your health is our mission. Each month, we bring you insights from leading medical experts, the latest advancements in care, and essential health tips to keep you and your family well. Let's get started.
This is Kathy Williams, and with me on tonight's program is Dr. Amanda Zahn, and she is a general surgeon with ProMedica Hospital. And Dr. Zahn, thanks so much for joining us.
Thank you, Kathy. It's a pleasure to be here.
So, are you a traveler? Or are you just here at Hickman? Do you do a bunch of different ProMedicas?
I'm here at Hickman full time since October of 2025.
Okay. And tonight we're going to be talking about robotic surgery. Your specialty is, of course, general surgery. So what is that? When does general surgery come into play rather than some kind of specialty type thing?
So a general surgeon is a board-certified physician that specializes in diagnosing, managing, and performing surgery for a wide range of disease and injury. Particularly, we focus on abdominal organs like the gallbladder, the intestines, breast, benign breast disease, cancerous breast disease, thyroid disease, skin and soft tissue problems. In general, we provide comprehensive care, including the preoperative evaluation, critical care, and, of course, the surgeries required, and postoperative recovery and care.
And then do they follow up with you as far as, like, when you remove cysts and things like that? Or do you become their follow-up doctor, or do they get referred back to someone else?
No, we always follow up because there's usually pathology to talk about. So they'll see the surgeon that did the operation, or sometimes we have physician assistants that are all part of our team, so they can sometimes do the follow-ups in simple, straightforward cases.
Exactly. So, when we hear the word robotics, and you hear it all the time in medicine now, what does that actually mean in, like, layman's terms?
That's a great question, and I'm really passionate about robotic surgery because of all the benefits that it offers. Robotic or robot-assisted surgery is a minimally invasive technique where we use a console that we sit at once we get the port sites in to control robotic arms. These arms are equipped with long instruments, a variety of different instruments to do what we need to do, and a 3D camera to perform complex procedures through small incisions.
Yeah, we've always wondered, how did they do that little teeny tiny thing before robotics? What a crazy nightmare that must have been.
Yeah, well, we did. I did a lot of laparoscopic work.
Okay.
But the dexterity is much more intense when you're able to use a robot.
Okay.
There's a lot of limitations to straightforward laparoscopic surgery.
Gotcha. So what's the most common use of robotics then that you participate with?
So many different fields use the robot, but as a general surgeon, I most commonly use the robot for hernia repairs, colectomies, which means removing part of your colon. When we have to do a colostomy, we can often reverse them using the robot. We take out gallbladders. That's called a cholecystectomy. We take out appendixes. That's called an appendectomy. We can also remove intestines or part of the stomach.
Wow. So there's a lot. You're kind of in the middle of the body, so to speak.
Yes.
Okay. So from a patient's perspective then, what would be the potential benefits of doing robotic surgery rather than other types of surgery?
There are many benefits that I've recognized. These smaller incisions mean less pain and a shorter hospital stay, if there is one, and a shorter recovery. I see my patients have far less pain than traditional old-fashioned open incisions, and even less pain than laparoscopic incisions. And the reason that is that there's far less torque and stretch on the abdominal wall as we're working. That cuts down on the micro tears that happen within the abdominal wall musculature, so therefore less pain. The robot keeps the port stable in space in the abdominal wall, and we work around a fixed place. So there's less lateral tension on the abdominal wall.
That makes so much sense because, I had friends have surgery for it. I go, you got to remember they were wiggling around in there. This is not going to be I feel good in 5 hour type thing. So the robotics sounds like it cuts down on that recovery time a little bit.
Significantly.
Yeah.
And they have to use far less narcotics post-operatively.
Right. Which also probably helps with recovery.
Yeah, there's many side effects to narcotics, so that helps in many ways.
Yeah. So what kind of special training then does a surgeon need in order to perform robotic surgery safely and effectively?
That's a great question. Many surgeons today come out of training fully trained in the robot because it's just part of the normal day-to-day experience for them. But when I trained, I'm an old gal. I've been doing this 19 years.
You're not that old.
I had to... well, at first I was a little reluctant to learn the robot because I was a very proficient laparoscopic surgeon. But when I joined ProMedica about 6 years ago, they gave me the time, the grace, and the resources to learn this technology. And I've never looked back. I would prefer to do everything through the robot if I can. But the training involves first doing online modules and training online, lots of reading and research. The second part is virtual reality training, practicing the skills, learning how to use the robot arms and move the camera. The next step, once you demonstrate a certain proficiency score in these simulations, you move on to dry labs or cadaveric labs, and then wet labs or anesthetized pigs is what we operate on.
So, a kind of a think, see, do.
Yes, and then the next step is to get hands-on experience with a proctor, an experienced robotic surgeon proctoring you for a certain number of cases, and then if you want to learn even more advanced complex things, we'll bring in a proctor until you meet that case threshold.
Qualification, I would imagine so. It's so many. You have to be able to do so many before you're allowed off on your own.
Absolutely.
One thing what one thing would you want people in the community to know when they're facing surgery or feeling anxious or unsure? I know there's always a lot of fear and skepticism. Is this really what I want to do? Do I really want to do it here?
Right.
Do I want to do it now even comes into play?
Certainly. Facing surgery can be anxiety producing in any situation, but whether it's elective or emergent, I want patients to know that it's okay to talk about their anxieties and to ask all the questions that they want to. We're here to answer their questions and make sure they're comfortable. I would want them to understand, most importantly, and I think this might be a misconception in the community, that the robot's doing the operation. I want to be clear that the robot does nothing independently. It is only a tool that the surgeon is using to gain greater dexterity, better visualization. We can work in tighter spaces. There's less blood loss, less risk of infection. And it allows us to do increasingly complex cases through these small incisions. The technology has clear benefits for the surgeon as well. When we do open surgery or laparoscopic surgery, we often have to stand at the table for hours on end, contorting our bodies in stressful, straining situations. And when we use the robot, once we put the ports in and get things set up, we get to sit comfortably at a console in an ergonomic chair with ergonomic settings, and I personally feel like this is going to keep me in my career for a lot longer.
Do you encourage, sometimes I've heard it helps to have an extra set of ears, so do you encourage people that may be a little more hesitant to maybe bring a friend or family member with them to help them understand better what's going on?
Studies show time and time again that when you're in front of your doctor having a discussion, you really remember only about 2 minutes of the conversation. So having a friend or family member there as an extra set of ears or to take notes for you is a really great idea. And as a patient, when I'm a patient, I do this as well.
I've even recorded. I've asked, can I record this?
Absolutely.
So I can listen to it later.
That's always welcome.
Yeah, and that's just it. I've never had a physician say, no, I don't want you to record me. They're telling you exactly what you need to hear.
Yeah.
So, Dr. Zahn, how are people referred to you? How do they end up with you?
So we do see a fair amount of referrals from people that come to the emergency room, but also from the local family practice docs, the internal medicine docs, and quite a few from the OB-GYNs.
Okay. So are they able to come directly to you? Or
yes. No referrals required.
Okay.
They could just call our office if they think they have a surgical problem.
And your office is here in Adrian?
Yes, it's at the hospital, Hickman Hospital, on the first floor in Suite C.
Okay.
Coming through the front door, and we're immediately to the right.
There you go. All righty. Well, thanks so much, Dr. Zahn. We appreciate you helping us learn about general surgery and robotics.
Anytime, Kathy. Thank you.
You're welcome.
That's it for this edition of Inside ProMedica, your path to wellness. We hope you've gained valuable insight into the exceptional care and services available at ProMedica Charleston, Virginia Hickman Hospital. For more information or to connect with our healthcare team, visit promedica.org/Hickman. Take care, stay well, and join us again on the last Tuesday of each month at 6:20 p.m. for another edition of Inside ProMedica, your path to wellness. You can also listen to these programs as podcasts anytime under the On-Air Audio tab at WLEN.com.